The Harvard red meat causes diabetes study is absolute nonsense. And stick around and I'll tell you exactly why. This study, the input of data is so poor that it's just absolutely astounding. Now, I reached out to Dr. Gu, who's the lead author, and I gave him a month to respond, and he didn't. Nevertheless, let's go to the study. Now, I reached out to Dr. Gu, as I said. I waited a month to see if he would respond. He went on Plant Chompers. He did not respond to me. There are various reasons he may not have wanted to respond to me. Number one is I don't have a very big YouTube channel. The other is he might not have had time, and he might have also thought, well, this guy's going to try to do some gotcha. I wasn't going to do gotcha. What I was going to say is, listen, let's look at your data, and can you explain to me how this makes any kind of sense in a real-world situation? I'm going to read you the press release from the Harvard School of Public Health. For immediate release, people who eat just 2 servings of red meat per week have an increased risk of developing type 2 diabetes compared to people who eat fewer servings. And the risk increases with greater consumption, according to a new study led by researchers from Harvard T.H. Chan School of Public Health. They also found that replacing meat with healthy plant-based proteins, such as nuts and legumes or modest amounts of dairy foods, was associated with a reduced risk of type 2 diabetes. The study was published Thursday, October 19th in the American Journal of Clinical Nutrition. Quote, "Our findings strongly support dietary guidelines that recommend limiting consumption of red meat, and this applies to both processed and unprocessed red meat," said first author Xiao Gu, postdoctoral research fellow in the Department of Nutrition. While previous studies have found a link between red meat consumption and type 2 diabetes risk, this study, which analyzes a large number of type 2 diabetes cases among participants being followed for an extended period of years, adds a greater level of certainty about the association. Certainty. They're certain. Type 2 diabetes rates are increasing rapidly in the U.S. and worldwide. This is concerning not only because this disease is a serious burden of disease, but also is a major risk for cardiovascular, kidney cancer, and dementia. True. For this study, the researchers analyzed health data from 216,695 participants from the Nurses Health Study, NHS Nurses Health Study 2, and the Health Professionals Follow-Up Study. That sounds really impressive. That's a lot of numbers, a lot of people. Diet was assessed with food frequency questionnaires every 2 to 4 years for up to 36 years. During this time, more than 22,000 participants developed type 2 diabetes. I'm going to get into that. I'm going to get into answering a food questionnaire every 2 years that says, how many times in the last year did you eat this or did you eat that? How many times a week? Utterly a joke. I mean, I can't tell you until I was carnivore. Now I can tell you what I had last Wednesday. I had red meat. I had red meat the day before that, and the day before that, and the day after that, and 16 days before that, and 32 days after that. So the researchers also estimated the potential effects of substituting 1 daily serving of red meat for another protein source. They found that substituting a serving of nuts and legumes was associated with a 30% lower risk of type 2 diabetes, and substituting a serving of dairy products was associated with a 22% lower risk. Given our findings and previous work by others, a limit of about 1 serving per week of red meat would be reasonable for people wishing to optimize their health and well-being. Senior author Walter Willett, I could talk about him a little bit, professor of epidemiology and nutrition. He has an obvious ideological bias, and he has presented it multiple times in the past. In addition to health benefits, swapping red meat for healthy plant protein sources would help, not could, would help reduce greenhouse gas emissions and climate change, and provide other environmental benefits, according to the researchers. According to the public health researchers who looked at the Nurses Public Health Study, they said, well, it's also going to improve climate change. It's a claim that's not backed by anything, not any kind of a reference. It just belies the ideological bias of the lead or the head author. And so there's so much here that I just have to just take a moment and let what I just read to you sink in. So some public health researchers at Harvard looked at the Nurses' Health Study, which is a questionnaire which comes out every 2 to 4 years where people recall back how many times a week they ate certain things. And they determined from that red meat increases the risk of diabetes. So at best, they have an association, at best. But I'm going to tell you, dig into the data, and it doesn't matter any of their statistical manipulations or calculations. For one thing, when you say a 62%, participants who ate the most red meat had a 62% higher risk of developing type 2 diabetes. Oh my goodness. Let's pretend that it was good data and well done scientifically. Let's pretend that. They're still trying to mislead you by saying 62% increase, because that sounds like a huge number. So what that means is if you went from a risk of 4% to a risk of about 6%, that's a 62% increase in risk. That doesn't mean that you have a 62% risk of diabetes. Why don't they just say it increases your risk from 4% to 6%? Because they are trying to mislead you. They're counting on the public not understanding that difference. It's the difference between absolute risk and relative risk. And they do it all the time when they're trying to prove a point if they don't have the data. The most important thing here is the data is so bad. I'm going to show you here from the actual Nurses' Health Study what they consider red meat. So here it is. So here you can see it. This is actually from the Nurses' Health Study. So this is what they consider red meat: salami, bologna, or other processed meat sandwiches. So it's not just the meat, it's also the sandwich. Well, I tell you, if I, back in the day, was going to have a salami sandwich, I was going to have mayonnaise on it. I was also going to have bread with my sandwich and probably some cheese, probably some processed cheese, and I was probably going to have some potato chips. And at that point, you might as well wash it down with a Coke. But anyway, I digress. A hamburger, one patty. So nobody eats hamburger patties except carnivores. So your hamburger, that means you're going to have cheese on it probably. You're going to have mayonnaise. You're going to have bread. Beef, pork, or lamb as a sandwich, again. Stew, casserole, lasagna, or frozen dinner. Now, I mean, this is literally from the study right here. This is from the data gathering that they used in this study. So what I'm going to do now is I'm going to read that press release back, and I'm going to substitute some actual data, which is perfectly reasonable that it could have been these particular things. So this is how it could have read. People who eat just 2 servings of lasagna per week may have increased risk of developing type 2 diabetes compared to people who eat fewer servings, and the risk increases with greater consumption, according to a new study led by researchers from Harvard T.H. Chan School of Public Health. They also found that replacing red meat with healthy plant-based protein sources such as nuts, legumes, or modest amounts of dairy food was associated with a reduced risk of type 2 diabetes. Our findings strongly support dietary guidelines that recommend limiting the consumption of frozen dinners, and this applies to both processed and unprocessed bologna. While previous studies have found a link between casserole consumption and type 2 diabetes risk, this study, which analyzed a large number of type 2 diabetes cases among participants being followed for an extended period of years, adds a greater level of certainty about the association. Type 2 diabetes rates are increasing rapidly in the U.S. and worldwide, but there's concern not only because the disease is a serious burden, but it also is a major risk factor for cardiovascular, kidney disease, cancer, and dementia. That's the only thing that I can say is reasonable in the entire press release. And like I said, I read the study. I paid $35 to download that study and read it. The researchers found that consumption of sandwiches, including mayonnaise and cheese, including bologna and ham, was strongly associated with increased risk of type 2 diabetes. Participants who ate the most hamburger helper had a 62% higher risk of developing type 2 diabetes compared to those who ate the least. Every additional daily serving of hot dogs with relish and ketchup, onions, and a bag of Fritos was associated with a 46% greater risk of developing type 2 diabetes, and every additional daily serving of a cheeseburger with mayonnaise, cheese, and French fries was associated with a 24% greater risk. The research also estimated the potential effects of substituting one daily serving of hamburger helper for another protein source. They found that substituting a serving of nuts and legumes was associated with a 30% lower risk of type 2 diabetes, and substituting a serving of dairy products was associated with a 22% lower risk. Given our findings and previous work by others, a limit of about one serving per week of lasagna would be reasonable for people wishing to optimize their health and well-being. Here's the thing. In addition to health benefits, swapping red meat for healthy plant protein sources would help reduce greenhouse gas emissions and climate change, and provide other benefits to the environment, according to these nutritional researchers who present nothing to back that claim. Even the idea that red meat contributes to carbon dioxide emissions, which is actually methane from the rumination of the cow's stomachs, even if you took that into account and believed that that was the actual cause of global warming, they don't ever look at, well, how much greener are those pastures that have grass-fed cattle in them because the cattle are restoring the soil every time they poop, and how much more life there is in that soil because they're there. And so there's just so much here that is just so shabby and so poorly done that these people must have known that the data was that bad, because they never really talked about it. They never said, oh, one limitation of this study is that we didn't really separate out red meat from all the crap that people eat with it. And that's one of the big problems, isn't it? People don't separate out red meat from a Big Mac. So I just wanted to go over that. It's shameful. I know it's not a new study, but I heard someone the other day say, oh, doesn't red meat cause diabetes? And I just about blew my stack, and I had to calm myself down. No, it actually doesn't. And that study was actually junk. So anyway, that's just my take on it. If you disagree, let me know in the comments. And thanks for coming to the channel.